When someone visits a hospital, they can receive many different bills. One from the doctor, another from the lab, another from the hospital itself. Even with insurance, people may still owe a lot of money. Many families are shocked when the bills arrive, long waits, and unfair access. It can take weeks to get an appointment, and emergency rooms are often overcrowded. People in rich cities usually get faster, better care. But in rural areas or poor neighborhoods, hospitals may be old, understaffed, or very far away. Mental health and long illnesses ignored. Depression, anxiety, and other mental health issues are not given enough attention. Therapy is costly and often not covered well by insurance. People with long-term conditions like diabetes or asthma are often left to manage on their own with little support. Same treatment for everyone. Doctors often have to follow one rule for all patients, but not everyone is the same. Some people have different needs, lifestyles, or cultural traditions. This one-size-fits-all approach leaves many people without the right care. Insurance blocks care. Even if people pay for insurance, the company can still say no to covering certain treatments. Sometimes claims are denied for very small reasons, and patients must fight long battles to get what they need. Those who know the system, how to ask, appeal, or choose the right hospital, often get better care than others. Too many tests and procedures. Hospitals sometimes order extra scans or treatments that are not really needed. They do this to avoid lawsuits or to earn more money. Patients pay for these extra tests even if they don't improve their health. Tired and overworked staff. Doctors and nurses work very long hours. They are stressed and burned out. Many spend more time filling out forms on computers than talking to patients. Nurses especially often have too many patients to look after at once. Not enough prevention. The system waits for people to get sick, then treats them. But it doesn't invest enough in keeping people healthy, like teaching about good food, exercise, sleep, and stress. Because of this, preventable diseases like diabetes and heart problems are very common. Care is not connected. If a patient sees 3 different doctors, those doctors often don't talk to each other. Mental health, physical health, and lifestyle are treated separately, even though they all affect each other. This makes care confusing and sometimes harmful. Success measured the wrong way. Hospitals are judged by money made, number of patients treated, or number of surgeries done, but they are not judged by whether patients actually live healthier, longer, or happier lives. Technology gap and bad systems. Some people can use telehealth, video calls with doctors, but others don't have internet or smartphones, so they are left out. Electronic systems in hospitals are supposed to help, but many are slow and create more work for doctors. Privacy risks. Health apps and insurance companies collect a lot of personal data. Patients often don't know what happens with this information, and sometimes it is sold, leaked, or stolen. Unequal hospitals. Hospitals in wealthy areas are modern, clean, and full of advanced machines. But hospitals in poor areas may have old equipment, too few doctors, and not enough medicine. This creates a huge gap in the quality of care people get. Patients not prepared for health life. Even after years of checkups, many people don't know how to navigate the healthcare system. They don't get enough guidance about insurance, managing stress, or preventing illness. People are given medicine, but not the life skills to stay healthy. Money comes before health. In the U.S., healthcare is treated like a business. Hospitals, drug companies, and insurance companies often make choices based on profit. That means sometimes patients don't get the best treatment. They get the one that makes money. Subscribe for more content like this.